Welcome back to We Are Austin. It's spooky season and football season, but don't let fear of a dental injury keep you out of the game. According to a recent survey, over a third of adults say they never played sports for fear of getting their teeth knocked out. Yeah. Happily, Dr. Craig Hirschberg, president of the American Association of Endodontists, is here to discuss the survey and what to do if a tooth gets knocked out. Good morning to you.
Morning, Chelsea.
What did your latest survey reveal about people's fears of sports-related mouth injuries?
Well, in addition to the result that you alluded to before, a similar number of patients feared having a tooth knocked out more than they feared having a bone broken or, tearing a muscle as sports injuries. We had over 40% say that they were avoiding holiday sweets because they were fearing toothache pain. More than a quarter reported that they were afraid to smile for holiday pictures because they were self-conscious about their teeth. And I'd say, the good news is more than half planned New Year's resolutions that they were going to do something to improve their oral health.
Yeah, that makes a lot of sense. If someone is feeling self-conscious about their smile, it is probably a constant thought on their mind, right? So what are your tips if someone has knocked out a tooth?
Well, if someone has a tooth knocked out, time is of the essence. It's really important to try to get that tooth back in the jaw as soon as possible. So you locate the tooth, you shake it free of debris, try to wiggle it right back into the socket where it came from. Now, realizing that sometimes that isn't possible, or sometimes that's outside of the comfort zone of an individual, you need to get to a dentist, to an endodontist, to an emergency facility as soon as possible to have the tooth replaced. But the tooth needs to be kept moist. So the best thing you could possibly do if you can't put the tooth back in the jaw is to get it into a container of milk, and the colder that milk is, the better, and then get to an endodontist, a dentist, or an emergency room and get that tooth put back in the jaw and stabilized.
Definitely not an ideal situation, but good information to have. Can you explain the difference between an endodontist and a general dentist?
Well, an endodontist is a dentist who has had a minimum of 2 years of advanced training. So that would be training in advanced endodontic procedures, and root canal treatment is an endodontic procedure. Also, they've had advanced training in pain control. And an endodontist practice is set up in a manner that they are accustomed to accommodating patients in emergency situations. So if somebody has sustained a traumatic injury to a tooth, or if somebody has a toothache, an endodontist is a great resource for care.
Great to know. Where can we go to learn more?
So our association's website, AAE.org, is a great resource, and there is an area of the website that's devoted to patient information. So that would be a great resource. Also, for patients that may have had a traumatic dental injury, or if a patient just has a toothache, findmyendodontist.com is a great resource. It's a database that you can access that can give you endodontists in your area, and patients can refer themselves directly to an endodontist for care.
Thanks, Doctor, for your insight this morning and for joining us on We Are Austin. Hope you have a great day.
Great. Thank you, Chelsea.